Well, let me introduce myself. My name is Becky Daughtry, and I'm a licensed clinical social worker, and I'm currently employed with the Healthcare Authority as the director for first episode psychosis programming in the state of Washington. I was honored to accept this position after working for a New Journeys program site where I helped to launch a first episode psychosis program in Thurston and Mason County. And I also did the family education practitioner part of the model. So I was really excited to work for New Journeys after hearing more about treatment for first episode psychosis. And it really came from a place of working as a clinical social worker for 30 years and seeing youth, young adults, and families in our system struggle to get services that were appropriate to what they were facing. And this really goes clear back to when I was an intern in graduate school 30 years ago and being assigned to work with a young man named Kevin, and he was awesome. He had bright red hair, and he had just been released from the hospital after his first episode of psychosis. And he wanted very much to get a job so he could earn money and have a girlfriend. And at the time, the method of treatment was to help young people get on benefits so they would have an income and set up for more or less the trajectory of chronicity. And at the time, I thought, well, I didn't really become a social worker to tell somebody to not get a job and to not pursue their dreams. So flash forward 20 years later, doing crisis work in Pierce County, I worked with families that had been taking care of their loved ones with chronic mental illness for years and years and years. And I was especially touched by this older gentleman. He was 75 and his wife had died and his daughter was 40 and was diagnosed with schizophrenia when she was a young adult. And he was beside himself with worry about what would happen to his daughter when he was no longer able to care for him. And so once again, as a social worker, I thought we can do better than this. And so along comes a new age of treatment for psychosis and New Journeys. And I was so excited to hear about the progressive work being done for first episode psychosis, because it is about working with people early on in the process and having it informed by the unique needs of families and young people that are experiencing symptoms of psychosis. And it captures their hopes and their dreams and encourages them to get back on track with those, that they can do it and families can have support and there is hope. So I could not be more honored to work with this great group of people, WSU, UW, the Healthcare Authority, and others that have lobbied in the Children's Mental Health Group to make this available to the youth and families in our state. Right now, the Healthcare Authority is working to implement the mandate of Second Substitute Senate Bill 5903, which says that we need to have these services available in every region of our state by the year 2023, and with more based on incidence and population in the future. So I'm impressed by Washington's devotion to our youth and family and excited and honored to be a part of it.